Hello and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. The revised tobacco bill, or its official name, the Control of Smoking Products for Public Health Bill, will be tabled for a second reading in Dewan Rakyat this Tuesday. Now, the bill will include the generational endgame, which seeks a lifetime ban of the sale of tobacco and vape products to anyone born after 2007. Now, this comes amid a worrying uptrend of vape use among Malaysian teenagers. So can the tobacco bill with a generational endgame turn the tide on vaping among minors? So let's ask health, behaviour and smoking cessation specialist Professor Dr Wee Lei Hum. She's with the School of Medicine at Taylor's University, also with Taylor's Impact Lab on medical advancement for better quality of life. Dr. Wee, thank you so much for joining me on the show today. Now, it's been 7 months since the government removed liquid and gel nicotine from the poisons list of controlled substances. And effectively what they did was legalize vape products vape products with nicotine to be sold to minors without any restrictions. I'm wondering what we know about the prevalence of vaping before that delisting, and what we know about the trends and the patterns that you've seen in the last 7 months since.
Okay, thank you, Melisa, for having me. To be very precise, the ungazetted of the nicotine from the Poison Act 1952 started in 1st April this year, which all of us, the tobacco control champions, feel that is the darkest day of, in the public health history. With that, meanings that we recognize nicotine as a non-poisonous product. Therefore, everyone, including minors, are allowed to use that. Right, so it's already been about 7 months has passed. What we can see that you were asking about the prevalence. Of course, we do not have data within the short period of time, but what I can see is that the obvious change will be no confiscation, meaning that it is no more illegal to sell vaping products. Therefore, you cannot seize the product anymore. So the product is easily available. It's easily available, easily accessible, and also the marketing or the advertising, the promotion, the sponsorships, you can no limitations. If last time you try to control or we try to get the Ministry of Informations or to classify or to also talk to the social media like Shopee or those shopping online to control and leave it out the products doing on sale. Now you can't do that anymore. So I think for the immediately after it was ungazetted, I think there are 2 major cases of EVALI or nicotine poisoning was reported. One was 2-year-old girl ingested nicotine liquid from Beras Pahang, and another one, that one was then developed seizure and then neurological disorder. And then unfortunately the 16-year-old girl, she died due to you call it EVALI. So that is unfortunate to die so young from the vaping that you think that we should not consume or use.
Right. So EVALI, I actually didn't know what it was until quite recently, but it is vaping-associated lung injury. So that I only discovered after reading about those terrible cases that you've cited. So the idea is to get this worrying trend under control, and the Control of Smoking Products for Public Health Bill. I'm just going to call it the Tobacco Bill from now on. So the Tobacco Bill, which includes the generational endgame, I'm wondering what your thoughts are, Dr. Wee, on this proposed legislation.
Yeah. Right. So as we know, it's also being publicized for the past few days that our minister, YBMK minister, and also Minister of Health, and also the chairman of PSSC, we present in Parliament on the 10th of October. So that's already fit. So from there, if I can see the bill actually is a very comprehensive bill, Melisa. It covers the purchasing, and then it covers the use, and then it covers, of course, is cover the generational endgame inside there. So it is a very comprehensive bill whereby it has a very detailed strategy of the preventive and protective as elements of the use of the vaping, meaning that it covers the about the advertising, the regulation for advertising, regulation for sponsorship, regulation for no more as a gift, and then also with the non-smoking area, and then also, of course, the over-the-counter means that over-the-counter point of sale. You know, now point of sale you cannot control, Melisa, because they can just place the vape product or the cigarette product at the place that you purchase or paying place, or together with the products for the children, for example, sweets, all those. And then the packaging of the product, meaning that you cannot produce or package produce the product that is similar and appealing to the children, the minors, and also for the teenagers. So all these is encompasses in the app, very detailed, and I think we should not. And I see this ad is the very because the prevalent rate of the tobacco use has been very slow in terms of going downward. It has been stagnant, more or less stagnant for decades. For the past 9 years, it hardly go up more than 2%, the reduction, whereas other countries is going down gradually, but we are quite stagnant in the prevalence of smoking in our country. That is bad. So meaning that, Melisa, whatever we have been doing so far, it is not working. Right? It is not working. And unfortunately, of course, the prevalence for smoking among the adolescent 13 to 17 years old is going downward trend, but exponential, sharp rise of the use of the vaping among this age group, 13 and 17 years old, which has gone up from 2017 to 2022 is about 5.1%. That is very high. And the female smoking has also been rising. So we are...
Right. So I hear you when you say there is a worrying trend. So something really needs to be done. But can I just ask you to elaborate? When you said that the rate of cessation or smoking cessation in Malaysia seems to be quite stagnant over the years, we can't keep doing the same things over and over again. Why do you think it is that we haven't been successful in getting people to quit smoking? And I'm wondering whether the factors that motivate someone to quit vaping is the same as to quit smoking.
Yeah, okay. There are a few perspectives in your questions. Okay, now we are talking about, then bring up my explanation of nicotine as a poisonous product, which is causes addiction, right? So from the literature, we know that most of the adult smokers do not come forward to the quit smoking clinic to get support to quit smoking. Because in the quit smoking clinic, we have trained professionals who are medical doctor that who are trained to manage the nicotine addiction. They use the combination of two strategies, that would be the pharmacotherapy and also the behaviour therapy. So they use, which is the has resulted in the higher success rate, Melisa. Right. So because of the nicotine is very highly addictive product, therefore many of them find very hard to quit. So they, as coming from my background of the behavior perspective, they know that the product is bad for them, and then to a certain extent they can feel that the health is affected by the consumption of the product. Therefore, when they come to our quit smoking clinic very late, they do not come on their own. They come because being referred by the doctor, because smoking is, as we know, is a risk factor of a few non-communicable diseases like the heart, lung, and also a lung cancer, or those diabetes, hypertension, you know. So they are coming late to get the treatment. And then most of them, because of heavily addicted, dependent on nicotine, many of them fail. And they lost to follow up, they did not complete treatment, therefore they're under treatment, or along the way they relapse and they discontinue the treatment. So we are talking about the adults, Melisa. The adults, they come late, they have long history of use. You know, they got a long history, 20, 30 years of use.
Right.
That's why the younger you use, the better for the industry. Because industry knows that when you use, Melisa, it's very unlikely for you to stop, because you are dealing with poisonous product that cause highly addicted to that. That is nicotine.
Right. Okay. So hopefully this generational endgame will stop any young people or anyone born after 2007 from picking up the habit. So the initiation of smoking. Can I ask you, Dr. Wee, what do you want to see? What challenges do you foresee in the implementation of this proposed legislation, and what are you hoping that policymakers and enforcement officers focus in on or hone in on?
Yeah, Melisa, I would like to take this opportunity to tweak a little bit on the what would be the benefits of the RUU, the bill, if it get passed. Okay, because now I think and I hope that the policymakers will listen to our program, and then I hope that they will consider to support the bill, especially to those on the bench, because I think that a lot of benefits that you will receive for the nation, especially for the young generation. One is because we all know it's open book that the nicotine was taken out for the Poison Act 1952 because I think the government wanted to tax the product.
Right.
Yeah. So with that, the government tax 40 cents per 1 milliliter. So I would like to stress here, Melisa, to the policymakers that if you regulate the vaping, you will get more tax, because if you see one cigarette, Melisa, one cigarette equivalent to about 1.5 mg of nicotine, and in one pack we have 20 sticks, so it's equivalent to 8 ringgit per pack. So and equivalent to around 30 milligram of nicotine content. If you consider that basis, the taxation rate based on the cigarette, If you tax equivalent to 1 ml, more or less you can get the market now 50 mg of nicotine in 1 milliliter. Therefore, you can gain the tax as high as 12 ringgit per 50 mg per 1 ml of the e-juice. That one, if you want to consider with the um, nicotine content per 1 ml. But if you want to consider puff, right? Possible one stick or cigarette, you get around 10, 15 puff. So if you calculate one stick, 10 puff, and then generally in vaping, you get around 100 puff to 600 puff for 1
Right.
ml. And then let's say you get the middle one, 300 puff, you get 10 puff for 40 cents. If you get 600 puff, you get around 13.30 per
Dr. B,
yeah.
are you saying to ensure that the
Yeah,
regulation vape
yeah,
industry
yeah.
is
You
maximizing the
regulate,
tax
you get more
income?
money.
Okay.
Yeah,
Understood.
because now,
Understood.
now Melissa,
All right.
without regulation, you see the label, Lisa, the label at the packaging. They wouldn't write the how many mg of nicotine. They just write puff, disposable one. They say 500 puff, 800 puff, 1000 puff. No one knows how much concentration of nicotine
Right.
inside the
Okay.
disposable.
Okay. Dr. Wee, unfortunately, we've come up to the end of our time with you, and I want to thank you so much for sharing your, your insights with us today. Thank you for your time. That was Professor Dr. Wee Dayham from Taylor's University. We're going to take a very quick break here and consider this. We will be back with more. Stay tuned. Hi, welcome back to the show. I'm Melisa Idris. You're watching Consider This, and tonight we are discussing vaping among minors. This ahead of the second reading in Parliament of the revised Tobacco Bill, or to use its official name, the Control of Smoking Products for Public Health Bill. This also includes the generational endgame in the proposed legislation. So joining me on the show tonight is Associate Professor Dr Noor Azimah Muhammad. She's a consultant in family medicine and senior lecturer at the Department of Family Medicine at UKM's Faculty of Medicine. Dr. Azimah, thank you for being on the show tonight. Now, as a family medicine practitioner, I am wondering what you have observed regarding the prevalence of vaping among teenagers in Malaysia. What concerns do you have about the trends that you are observing when it comes to the impact of vaping on adolescent health?
All right. Thanks, Melissa. Definitely, this is a big issue. The vaping among our youngsters. We observe that in our surroundings. Vaping openly, physically, when you even may perhaps ban them, but you know that they are actually promoting themselves, or they are very proud of themselves being able to vape. So if you look into the data, one of the project that was conducted in Kuala Lumpur, about 40% of school children are smoking. But of course, in the National Health Morbidity data, the year 2022, the recent one, you see the number of vape, vapors are actually increasing compared to the traditional cigarette. So in short, yes, it is increasing and is growing problem among our adolescents, and is happening either uh, among the schoolers or non-schoolers in the ordinary schools, sekolah harian, or even in the boarding school. So it's a big issue.
Yeah, it sounds like, the fact that the government delisted liquid nicotine and gel nicotine from the poisons list some 7 months ago, but this seems to have been a growing trend even before that. Can you share with us let's explore the sources of where teenagers are obtaining these vape products so that authorities may know, to take this into consideration in wanting to regulate perhaps the vape industry?
Well, I suppose there's no clear-cut statement that actually mention or banning vape compared to cigarette to the minors. Well, I suppose if you see related product, smoking product, yes, but in reality, um, the enforcement or the statement that our government is making is far beyond what Singapore is making. You know, in Singapore, it is really wrong for the public to use, to sell, or to possess the e-cigarette. As simple as that. There's a clear statement saying that. But in our country, everywhere you basically, I mean, in the place where I'm staying now, you can see at least you can find 2 or 3 the vape shop easily available. And who are the people who would stop the youngsters to get into this shop? That one, the physical shop. And if we talk about the online shop, uh, the issue is even deeper, right? If now, because the e-cigarette is not in the form of what it used to be, is so big. Now you can get the device as small as a thumb drive, for example, about 5 cm, or even in pen form. So because it is so easy, that's why it gets to our youngsters' hand. And another issue is because this e-cigarette is relatively cheap, the disposable one, you can get about what, 10 ringgit to 20 ringgit per device that would allow them to have how many puff? 10,000 puff, and they can share among them. I mean, youngsters, the adolescent, they really care to each other, right? So they share among them. So that's how it get to them. And to some parents, they may not even know how does the pot look like.
Right.
Yeah. So
Right. Well, you're absolutely right. The availability of it, the price of it, but also the packaging of it. It doesn't look like a traditional smoking device, but it's also maybe packaged to target to a younger audience. So colorful and
flavor.
different flavors as well to target perhaps a younger audience. Are you hoping for regulation on that?
Yeah, I mean, how I wish that we can copy at least some of the country where they actually banned all this e-cigarette with flavors. If I'm not mistaken, US has banned that, or UK. I need to check that. But there are countries that banned the e-cigarette with flavors. So there should be a move towards that. And what I'm proposing is just stop selling the e-cigarette as often as what it is now. The e-cigarette should be as a form of helping the smokers to quit. That's how it was bring into the public to begin with. And we should stay as it is. So the problem is there's promotion mentioning that e-cigarette is safer compared to the traditional cigarette. And this myth that leads to what is happening to our teens.
Can I ask you from a medical perspective, Dr. Azimah? I'm sure that nicotine exposure, particularly during that adolescent time, will have a significant impact on their health. I mean, the brain is developing until you're about 25, right? Are there specific health concerns or challenges that make vaping among teens a significant public health issue?
Yes, the nicotine can lead to addiction. straightforward relationship, Melissa. And of course, being youngsters, being adolescent, they are very creative. So they refill liquid. They can actually put whatever that they want to put, including marijuana, cannabis, and all the synthetic drugs can be put into that. So we the additional drugs, if they put into the device, will of course lead to another issue of addiction.
Well, part of the generational endgame proposed legislation wants to have this lifetime ban of the sale of tobacco and vape products for anyone born after 2007. But what they want to do is essentially include a 2-year educational enforcement period. Can you share with me what you think is necessary to go into that period to stop, I guess, to stop people from wanting to smoke or to move away from vaping?
Because the e-cigarette is relatively new to us, about 20 years or so, right? There's no long-term study looking into the long-term complication. But what we know, the e-cigarette leads to irritants, leads to inflammation to the lung. So you've heard about the lung injury because of the e-cigarette, right? The Vali.
EVALI, okay.
Diwali, yeah, and it also causes irritation to the throat, yeah, and some people may have the gastrointestinal side effect, and whether this lung condition is reversible or not, no one actually knows as yet. But it looks like because of this chronic irritation to the lung, it can injure the lung. So, these youngsters, they are too young to have lung problem, and we do not know how soon it will take effect. But we do know within these 20 years, there are a lot of cases has been reported, even in our local country, where Pusat Racun Negara has reported a number of cases related to e-cigarette and the nicotine. So I think within these 2 years, these are the things that we need to highlight to the public, the ill effect of the e-cigarette. We need to change the mindset. It is not as alternative to the traditional cigarette. Now people think vape is safer compared to the e-cigarette, and people do not actually highlighting all these complications.
Right. Okay. So that needs to go into the 2 years of education to the public.
Yeah, and the banning and the fine.
Yes, definitely. So unfortunately, Dr. Azimah, we've run out of time, and I want to thank you for being on the show. Dr. Noor Azimah Muhammad there, wrapping up this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and good night.